Understanding the psychology of hoarding. Hoarding disorder is a complex mental health condition where individuals have difficulty discarding possessions, leading to excessive clutter. Unlike simple collecting, hoarding is often driven by emotional attachments, anxiety, or fear of loss. This behavior can severely impact daily life, relationships, and mental well-being, making it crucial to understand its psychological roots. Emotional attachments and fear of loss. Many hoarders attach deep emotional significance to their belongings. Items may be linked to memories, security, or a sense of identity, making them difficult to discard. Some fear that letting go of objects means losing a part of themselves or their past, reinforcing their compulsion to keep accumulating. The role of anxiety and OCD traits. Hoarding is often associated with obsessive-compulsive disorder, OCD, and anxiety disorders. People with hoarding tendencies may feel extreme distress when faced with decisions about what to keep or discard. This anxiety leads to avoidance, making the problem progressively worse as clutter piles up. Cognitive distortions in hoarding. Individuals with hoarding disorder frequently struggle with decision-making, organization, and categorization. They may believe that items will be needed in the future, even if they have no practical use. Others experience just-in-case thinking, fearing regret if they throw something away, leading to excessive accumulation. The influence of trauma and emotional pain. For some, hoarding behavior is rooted in past trauma, loss, or emotional distress. Experiencing a significant loss, such as the death of a loved one, can trigger hoarding as a way to create a sense of control or emotional protection. Objects become symbolic stand-ins for relationships or stability. Social isolation and its effects. Hoarding often leads to social withdrawal as individuals feel ashamed of their living conditions. They may avoid visitors, causing loneliness, depression, and increased dependence on material possessions for emotional comfort. This cycle makes it even harder to seek help or make changes. The impact on health and daily life. Excessive clutter can create unsafe and unsanitary living conditions, increasing health risks such as fire hazards, mold growth, and difficulty accessing essential spaces like kitchens and bathrooms. This not only affects the hoarder but also impacts family members and even neighbors. Treatment and intervention strategies. Cognitive behavioral therapy, CBT, is one of the most effective treatments for hoarding disorder. It helps individuals challenge irrational beliefs, develop organizational skills, and gradually let go of unnecessary items. In severe cases, professional intervention may be required to safely clean and restore living spaces. Encouraging support and compassion. Hoarding is often misunderstood as laziness or stubbornness, but it is a serious mental health issue. Offering patience, understanding, and professional support can make a significant difference. Encouraging small, manageable steps instead of forced cleanouts helps individuals regain control without overwhelming distress. Breaking the hoarding cycle for a healthier life. Overcoming hoarding requires a combination of psychological treatment, social support, and self-awareness. By addressing underlying fears, improving decision-making skills, and gradually decluttering, individuals can break free from the cycle of hoarding and reclaim a healthier, more organized life.